Hello, this is Dr. Aryan Mowlavi coming to you from Hidefacademy. Today's challenge for the liposuction questions is, can liposuction reduce breast size? All right, so you guys, might sound a little confusing, but let's just go through this. So breasts on a woman are different sizes, obviously, and they're often associated with cup size, A, B, C, D, double D. Sometimes when they're even larger, women want to reduce their size. The conventional method of doing this is called a breast reduction. A breast reduction allows you to architecturally design a reduction of the breast where you remove not only the skin, but also the soft tissue, sometimes even the glands. But in so doing, you're also able to lift the breast. So by repositioning the nipple up higher in a more aesthetically preferred position, we're able to design these variable designs. There's actually 5 or 6 different kinds that are most popular, and there's different ways to do it. You're able to isolate the skin and soft tissues away from the nipple areola and the gland complex, and then move that gland up and then wrap around in different ways to achieve both a reduction in your breast as well as a lift of the nipple areola. Now, this surgery, the conventional traditional breast reduction, is intended for patients that are actually not only large in size, but also sagging. And so sagging means the nipple and the breast mound are too low. Typically below the crease, the inframammary crease is the natural junction that divides the breast from the tummy. When the nipples fall below to that line and or more below that line, more even, then it's a good time to consider a breast reduction, which will not only lift the nipples up, but also give you a reduction. It's a very effective surgery. Often patients come to us because they're having upper back and neck pain, shoulder grooving. It's affecting their lifestyle, ability to exercise, and so often it's medically covered, and it's a wonderful surgery that's been done for centuries. So that's your conventional breast reduction. Now, recently, it's become popular to reduce or consider reducing the breast size with liposuction alone. So what does that mean exactly? Well, it literally means if you liposuction the breast, you can remove the fat and possibly some of the glands, although the glands are more fibrous, and you can literally reduce the volume of the breast. So the answer to the question is yes, you can use liposuction to reduce breast volume and breast size. But the question is, who is a good candidate for this? So obviously, by lipoing the breast, you are going to be able to reduce the volume by often like 20, even maybe 30% is I think reliable. But what we have to consider is making sure that you understand that by reducing the breast size, you are not going to affect the nipple areola position. In fact, it might even be more droopier. So if there's skin redundancy and sagging and laxity in the skin, and if the nipples are low, liposuction is not going to resolve those concerns. Okay? So who is liposuction to reduce breast size good for? It's for the younger patient whose breasts haven't really sagged, but they're just a little too large for them, and they want a little light liposuction to reduce their breast size, maybe by a cup or so. The other person that it's good for is for a revision of like someone who's had a breast reduction, who's already been tightened, the skin envelope's been tightened, the nipple has been brought up, but they want just a little bit more reduction in the size that was possible with the initial reduction. Remember, a reduction in breast size, there's a limit to how much you can reduce them, even with the conventional invasive surgical excision technique. So there's 2 patient populations that benefit from liposuction for breast size reduction. One is the younger patient who's not sagging, who's not loose, but just wants to be a little bit smaller. And second, it's for that revision case of a reduction patient who wants to have a little bit smaller breast, but who's already been tightened and lifted. I hope you enjoyed that question. Please subscribe to our channel. Please click on that alert button so you get a notification on our next video. And we look forward to seeing you next. Thank you.